Homocystinuria is a rare autosomal recessive disorder involving abnormal homocysteine metabolism. It is characterized by the accumulation of homocysteine and its metabolites in the blood and urine, hence the name Homocystinuria. In this video, I'll give you my visual mnemonic to help you understand and remember the pathophysiology, symptoms, and treatment for homocystinuria, so you'll be ready to answer any question about this condition on test day. Look who it is! Yep, it's Homer Simpson. And as usual, he's up to no good. Looks like he really needed to go, but he couldn't find the normal bathroom. Like any good father, he was spending all day with Bart and Lisa, but he just couldn't find the adult urinals. Out of desperation, he's using these kitty-sized urinals. This entire scene on Homer Simpson in the bathroom should help you peg the disorder homocystinuria. Homer Simpson for homocysteine and urinals for urea. Get it? But before we go any further, let's take a step back to understand the biochemical mechanisms that cause homocystinuria. As discussed in our other video on homocysteine metabolism, homocystinuria can be caused by defects in 4 enzymes or vitamins: cystathionine synthase, vitamin B6, methionine synthase, or MTHFR. Let's review these causes really quickly. First, homocysteine can accumulate due to a deficiency of the enzyme cystathionine synthase. If you're not converting any homocysteine to cystathionine, then you're going to be left with an excess of homocysteine. Homocysteine that will cause homocystinuria. Second, homocysteine can accumulate where there is a decreased affinity of cystathionine synthase for the cofactor vitamin B6, or its active form, PLP. You know if cystathionine synthase cannot bind vitamin B6, then the reaction cannot also go forward to cystathionine, and homocysteine builds up. Makes sense, right? Third, a deficiency in methionine synthase can result in an overaccumulation of homocysteine, resulting in, you guessed it, homocystinuria. You know since homocysteine is usually metabolized into methionine, that without this enzyme, homocysteine builds up, leading to homocystinuria. And fourth, homocystinuria can be caused by a defect in MTHFR. MTHFR regenerates MTHF, a necessary cofactor for converting homocysteine to methionine. Without this cofactor, we get a buildup of homocysteine upstream, leading to homocystinuria. You got that? Now that we've discussed the biochemical pathways involved in homocystinuria, let's go through its symptoms. First, take a look at Homer's gargantuan size relative to this kitty-sized urinal. Let Homer's tall stature remind you of one of the key symptoms of homocystinuria, which is marfanoid habitus. Where have you heard of marfanoid habitus before? Yep, that's right. Marfanoid habitus just refers to a set of symptoms commonly associated with Marfan syndrome. These symptoms include tall stature and really long limbs. Specifically, marfanoid habitus is characterized by an arm span that exceeds the height of the individual and elongated fingers and toes. Just remember Homer's tall size compared to this kitty-sized urinal to remember that homocystinuria causes marfanoid habitus. For those of you looking for extra explanation, just know that homocysteine can interfere with collagen cross-linking. Collagen, of course, makes up bones, so you can imagine how this might lead to skeletal deformities. It's extremely important to note here that test makers will try to confuse you with answer choices, including both homocystinuria and Marfan syndrome. As we've already discussed, homocystinuria can cause marfanoid habitus, but there are other important clinical clues that will help you distinguish between homocystinuria and Marfan syndrome. We'll talk about these later in this video, so stay tuned. Next, notice how Homer's bending over to use his children's urinal. Of course he's bending over. He's way taller than the urinal. This image of Homer arching his back to use the kitty urinal should help you remember that homocystinuria can cause kyphosis, a spinal disorder characterized by a forward rounding or hunching of the back. As you may already know, Kyphosis is a type of skeletal deformity. Just like Marfanoid habitus, this hunching is caused by homocystine's interference with collagen cross-linking in the bone. Makes sense, right? Now, let's notice how Homer's looking downwards and inwards while he tries to use this urinal. Of course he's looking down to use a urinal. I don't think you need a mnemonic for this one. Okay, so he's looking downward and inward, and his gaze should help you remember that homocystinuria can cause lens subluxation and other ocular abnormalities. Lens subluxation is also known as ectopic lentis, and it refers to the partial displacement of the eye's lens from its normal location. And what's super high yield here is to remember that this lens subluxation is downwards. Of course it's downwards, because Homer's looking down. Remember from earlier how exam writers can confuse you between Marfan syndrome and homocystinuria? Well, while both have Marfanoid features and both syndromes can involve lens displacement, the lens displacement in Marfan syndrome is upwards and outwards. Yes, this is the opposite of what we see here in homocystinuria, which is downwards and inwards, because you've got to look downwards and inwards at the urinal, right? Next, take a look at this picture of a little turtle in this urinal. Okay, so you always see these little animals in the urinals. Is it to help with aim or something? Anyways, this little turtle should help you remember the developmental delay seen in homocystinuria, because a turtle is our recurring symbol for developmental delay. I mean, what's more delayed than a turtle? Whoa, what is going on here? It looks like a pipe just burst. Ew, just Homer's luck. Take a look at the inside of this pipe. No wonder why it burst. It was full of this gunk. This filled pipe should help you remember that homocystinuria can also cause arteriosclerosis and thrombosis. This is a super high yield finding, as patients with homocystinuria are at high risk for cardiovascular complications like heart attacks and stroke. Now, let's briefly take a moment to discuss the inheritance of homocystinuria. Take a look at this small cart over here. Yep, it's a small bathroom cart. What else would you expect to see in a bathroom? At Pixarize, we use large dominant automobiles like cars and trucks to symbolize autosomal dominant disorders, and small recessive autos like carts to symbolize autosomal recessive disorders. Let this image of this small recessive cart remind you that homocystinuria is an autosomal recessive disorder. Finally, take a look at the bottle of bleach on this cart, but oh no! The bleach has been accidentally knocked over onto the floor. Let this bleach remind you of one of the more characteristic findings in homocystinuria, which is fair complexion and hair. You probably won't remember this for test day, but this hypopigmentation is thought to be due to homocystine's inhibition of tyrosinase, which is a major pigment enzyme. So, given these pretty severe symptoms, how exactly do we treat homocystinuria? Well, recall how we mentioned earlier that there are different causes of homocystinuria. Our treatment regimen will be tailored based on the cause. If the key defect involves decreased affinity of cystathionine synthase for pyridoxal phosphate, then you'll have to treat this defect with increased B6 and increased cysteine in the diet. If the defect involves decreased methionine synthase, you'll have to increase the level of methionine provided in the diet. Finally, if the defect is caused by a deficiency in MTHFR, treat the condition with folate. If this doesn't make sense right away, try to review our other video on homocysteine metabolism to put all of these bits and pieces together. This is one disease where the biochemical pathway is especially important. Geez, that was a lot of material to cover in one video. I really don't want to spend more time in this kid's bathroom, so let's do a quick review and get out of here. Alright, so homocystinuria is an autosomal recessive disorder that is caused by an overaccumulation of homocysteine in the body. It's caused by defects in cystathionine synthase, methionine synthase, vitamin B6, and MTHFR. Clinical manifestations of homocystinuria include Marfanoid habitus and kyphosis, caused by defects in collagen cross-linking, ocular abnormalities such as lens subluxation, developmental delay, thrombosis, and arteriosclerosis, and finally, hypopigmented skin and hair. Alright, so that's it for this video on homocystinuria. Until next time!